Hi, this is Dr. David from Magnolia Skin Center, and we are here to get some information out for some questions that staff has put together. The subject today is Revanesse lip augmentation. So, what is Revanesse lips? Revanesse is a particular brand or type of a hyaluronic filler, has particular qualities that are exceptional for the lips. So, here are the questions. Let's get right into it. How does the built in numbing medication make getting lip filler comfortable and easy to handle? Okay, so this lip filler has lidocaine or numbing medicine in with it. Um, it is not going to change the feeling of as it goes in. And just for informational purposes, when I do lips, as opposed to what a lot of people do, I make sure it's painless. So I do that by a combination of topical numbing, plus I can actually do some blocks that you literally do not feel me putting in your lip filler, which is a little different than what a lot of places do. So, however, the built-in numbing, once it's gone in, means that it's not going to be sore or uncomfortable for the few hours after I place the lip filler in. How swollen will my lips look the next morning, and when will I see my actual final lip shape? This particular lip filler is designed to not attract a lot of water so that you won't get a lot of extra swelling afterwards. So therefore, pretty much the way it looks is the way it's going to look when I finish. Having said that, it is a little unpredictable when you put filler into somebody's tissues. You are moving the tissue around a little bit, so some people will swell more than others. So it just depends on how much you personally might swell. And we have you do things like cool packet, that sort of thing. So if you swell more than we think, it might take you a week to like really reach your final lip shape. If you don't swell a whole lot, then that final lip shape is going to be pretty quick. Um, will this lip filler give me a subtle, naturally defined pout, or is it only for massive, dramatic lips? Okay, so the answer to that question is I'm the artist. It depends on what I do with that lip filler, right? And you and I will talk and look and educate and decide what your vision of what you want your lips to be, and then what I think would be helpful or right to do. And we have to meet minds. Once we meet minds, so that I'm sure that we're on the same page, then I'll give you the look that we have agreed upon that you would be happy with. Okay. One one thing of note, um, very large, massive lips, as this says, massive, dramatic lips, is not really a great idea. When you actually look at what very large lips do to the face, they actually kind of age you. So it's an artistic vision where we really decide what's really going to make you look as youthful and as desirable and as natural as possible. Okay. Will my lips still feel soft and natural when I'm kissing or talking, or will they feel firm and rubbery? Again, there's two factors involved here. This particular lip filler is a very soft filler, so it will feel natural. It will feel like it's just a part of you. It also depends on how much I put in, where I put it. Okay, so again, that's sort of the skill of the injection artist, which is me, and then and it's also what your vision is. If we've decided that we want a little more volume, then there's going to be a little bit more uh, to feel after the procedure. Why do almost all patients still love their lip volume at 6 months? What makes it hold up so well? Okay, the reason why this particular filler does so well is the way that this particular hyaluronic acid product is cross-linked. It lasts a very long time. So, because different fillers, depending on how they're made, will degrade faster than others. This one is designed to last for a long time and to be resilient and stable, even in areas where there's a lot of movement. So that's why people with this particular filler are still very happy with their lips 6 months, way after 6 months after the injection. Can Revanesse lips fix an uneven or asymmetrical lip shape and smooth out vertical smoker's lines? The answer to that is yes. One of the things that we do is we look at the exact structures of your lips and see where there's asymmetry. Now, remember, we cannot actually create perfect asymmetry. Nobody has it, but we move toward symmetry. Okay. So yes, we can absolutely enhance one side more than the other, or whatever we need to do to bring you toward balance. Um, how many syringes of filler does a beginner usually need to get a beautiful, naturally looking lip update? Usually, we're never going to be working with more than one syringe of filler. Okay, one syringe of filler in lips is a lot, and the amount that you can get done or you can do with that is a lot. Some people really don't even need a whole syringe. Some people, we're going to use half a syringe and then we'll use the other half somewhere else. Somewhere else on your face, etc. So one syringe is usually going to give you a dramatic result. So I hope that gives you some idea. But come in and see me at Magnolia Skin Center. We'll sit down. We'll look at your individual case. We'll see what you want to achieve, and we'll see what's the right thing to do with you. So thank you. This is Dr. David at Magnolia Skin Center.